Mr. Benson is refusing treatment and transport for a suspected myocardial infarction. He has provided the paramedics with an advanced healthcare directive and informed them why he is refusing. However, his daughter Jenny is his designated health attorney and wishes for Mr. Benson to receive treatment and transport. Our problem is, who has the authority to make Mr. Benson's healthcare decisions? Here are the facts. Mr. Benson is 69 years old and in otherwise good health. His wife recently passed away. He has a good relationship with his GP regarding health concerns. One day, Mr. Benson was feeling unwell. He called his daughter Jenny, who consequently called an ambulance against his wishes. Mr. Benson immediately informed the paramedics he did not want treatment or transportation, but was compliant with their question and assessments. From these assessments, the paramedics informed Mr. Benson he was likely suffering an acute myocardial infarction. Mr. Benson voluntarily agreed to the administration of oxygen and sublingual nitrates upon their advice. Mr. Benson still refused further treatment and transportation, providing the paramedics with a copy of his advanced healthcare directive, and informed the paramedics he would heed their advice to see his GP. Jenny was informed of Mr. Benson's decision, but believed that as his health attorney, the paramedics should comply with her instructions. Let's consider the principles of bioethics and how they relate to Mr. Benson's capacity to make informed healthcare decisions. The first principle of bioethics is autonomy. According to Townsend and Luck 2013, autonomy is the respect for the individual and their ability to make decisions about their health and future. In addition to this, the World Health Organization and Australia Charter of Healthcare Rights highlight that the patient has the right to make decisions about their care. Autonomy is the principle that provides the basics for informed consent or refusal of care. To uphold the patient's autonomy and right to make healthcare decisions, these three conditions must be satisfied. Liberty. Mr. Benson was free from controlling influence when he made his decision to refuse treatment and transport. Understanding. When Mr. Benson decided to refuse treatment and transport, he was well informed about the condition he was likely suffering, what the paramedics believed to be the best course of action, and the likely consequences of not following such medical advice. Agency. In Mr. Benson's case, there are a few things to be considered to ensure he did have the capacity to make an appropriate decision. His mental state. Given the recent death of his wife, it might be argued that there is a disturbance in Mr. Benson's mental capacity, thus resulting in an inability to make reasonable healthcare decisions. However, Mr. Benson's behaviour does not indicate an immediate risk of serious harm because he has no thought of suicide or history of attempts, and he has a good social support through his relationship with his daughter. The grief Mr. Benson is experiencing over the death of his wife is normal and to be expected. Over the 80 minutes that he spent talking with paramedics, he appeared reasonable and justified in his decisions. There was no evidence of a major disturbance in mental capacity. Although it is accepted that Mr. Benson requires medical treatment for his suspected MI, it is not deemed that he has a major mental disturbance requiring treatment and therefore can refuse treatment for his suspected MI. Furthermore, Mr. Benson was administered GTN. Despite it being contraindicated by his low blood pressure, this may have impaired his mental capacity. However, the paramedics sat and spoke with Mr. Benson for 40 minutes following its administration and observed no adverse physical side effects. According to the QAS drug therapy protocol, GTN has a duration of 20 to 30 minutes. Thus, this would have been sufficient time for the effects of it to subside. Although the GTN did not appear to have caused any physical or mental disturbance to Mr. Benson, its administration was still contraindicated and thus did not uphold the bioethical principle of non-maleficence, which states that, as far as possible, you should not harm a patient, either through action or inaction. This raises the argument that if the paramedics were to not transport Mr. Benson to the hospital for treatment, would their inaction cause further harm? And should we not, as far as possible, do all we can to help our patients also? In Mr. Benson's case, respecting his autonomy and healthcare decision is the best way to uphold the ethical principles of beneficence and non-maleficence. Paramedics Australasia Code of Conduct and National Code of Conduct for Healthcare Workers in Queensland highlight some key principles and values healthcare workers should aim to uphold in their practice. Of significant importance in Mr. Benson's case is respect for Mr. Benson's decisions regarding refusal of treatment.
Created using Powtoon.